let us start this mega BIOBIO 2010. Now, I'd like to invite Dr. Shyam Haider, the lead pharmacologist, Food and Drug Administration, United States of America, to take his position on that. And I'd like to invite Dr. Rajendra S. Pradhan, the Director, Clinical Pharmacokinetics and Pharmacodynamics from OMICS, United States of America, to take his position on the dais. Now I request Professor Alam Apara, the Vice Chancellor from JNU, Kakinada, India, to take his position on the dais. Now I request Dr. Redena, the Professor from University of Hyderabad, India, to take his position on the dais. Now I request Dr. Jayachandra Reddy, the Vice President, Access Clinical, India, to take his position on the dais. Now I request Dr. V. Venkateshwarlu from Dr. Reddy's Laboratories, India, to take his position on the dais. Now I request Dr. Sudhakar Akupalli, the Director and Coordinator, Cell Signaling and Tumor Angiogenesis Laboratory from Boys Town National Research Hospital, United States of America, to take his position on the dais. Now I request Dr. Praveen S. Ramath from Pharmaceutics International Incorporation, United States of America, to take his position on the dais. Now I request Dr. Srinivasan Gedera of Stanford University, on behalf of the editors, Journal of Bioequivalence and Bioavailability, the promoter of BIOBIO 2010 in India, and whose hard work all of us are here. I request you please take his position on the dais. Now, I would like to request Dr. Srinivasan Gedera to speak a few words about BIOBIO 2010.
Bioequivalence and Bioavailability, Pharmaceutical Research and Development Summit, the BIOBIO 2010. I congratulate the OMICS Publishing Group and editors of Journal of Bioequivalence and Bioavailability to motivate this event in India. Initially, we planned to organize, and later we shifted to India as organization from me and some of our executive editors of Journal of Bioequivalence and Bioavailability. And as you know, India is the hub of BIOBIO studies, and we planned this event to organize in India in the first time. Initially, our expected participants are just 100, but it is moved to nearly of 250 to 300 people, and have came from all over the world across the continents of nearly 25 countries. The subject of the conference is surely of global importance. It is the first world conference on bioequivalence and bioavailability. Let me therefore add a word of welcome all the speakers, guests, students and delegates. I wish you a pleasant stay in Hyderabad and fruitful deliberations at the BIOBIO 2010. And thank you all the speakers, sponsors for this continuous encouragement and patronage. Shortly, we will announce the venue of BIOBIO 2011, and we are happy if we can get initiations from anybody of you. Thank you one and all. Now I request Dr. Shyam Haider to speak few words about BIOBIO 2010.
Good morning everyone. It is my great pleasure to be a participant in the BIOBIO 2010 conference in this historic city of Hyderabad. Bioavailability and bioequivalence are two very important topics in drug development as well as from a regulatory perspective. Much research has been done in this area for the past several years. Keeping track of these developments on a global scale is a major challenge. For this reason, I feel this conference is a step in the right direction. And I wish to congratulate the organizers for the hard work they've done to put together a very valuable program for the attendees over the next few days. Thank you.
Now I request Dr. Rajendra S. Pradhan, the Director of Clinical Pharmacokinetics and Pharmacodynamics from Abbott Labs, the United States.
I would like to thank the organizers of this meeting for inviting me and giving me this opportunity. I'm also very pleased to be here today at Hyderabad. I come from a big pharma perspective to this meeting, and really what's going on today in the world is a big force of globalization. And as a result of globalization, pharma industry in general is trying to do several things. It's trying to consolidate the supply chain, it's trying to consolidate the manufacturing operations, to take care of, to manage the costs, medical costs, to prevent counterfeiting in general. And as a result, regulatory agencies on their side are trying to harmonize the regulations to deal with the changes that are taking place. When I come here today, I hope I will see, and you will see, actions between these two forces or two activities, industry on one side and changing regulations or harmonizing efforts in regulations on the regulatory front. US FDA tends to be at the forefront of these activities, but I see EMEA and Health Canada in close following these days. Health Canada just consolidated about 11